Good morning, and thank you for joining us for the 90th edition, if you will, of the Flint Community Webinar on Coronavirus. Please let me welcome you today. It's a very important day. I'm your moderator, Yvonne Lewis, and I'm so excited to be here with you. Today, this program for the 90th week is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center of Michigan. We today have an exciting program designed for you, but as we begin, I want to let you know that we're interested and open to your questions and comments, so please put them in the Q&A for us. Let us know what you're thinking. As the co-director of the Healthy Flint Research Coordinating Center, we want to express on behalf of all the partners how much we appreciate your participation for these 90 weeks. You can see, if you've joined us in the webinar, that we have this array of partners, and we will be saying thank you and highlighting each one of them during these next few weeks. We want to make sure that you understand and know that the reason for this webinar is that we can bring a local context to this global pandemic. Things are changing every day, and so it's important for us to be able to be up on what those changes are. Before we move into our webinar today, I just want to take a moment. And it's so apropos because we're going to be hearing from faith leaders. But we had a tragic event in our state, which is just a few miles away from us, the school shooting. Some of our schools in our county have closed as a result of that experience. But we want to take a moment and give thought and prayer for those who have lost loved ones and the trauma that is being faced, not only by the children in the school, but the families and the parents, and even for some of our children who may have some concerns about their safety in school. We're experiencing trauma on top of trauma. And so it's really, really important that we find mechanisms in order to help us to deal with these traumas. I want to let you know that one of our partners, the Genesee Health System, is already preparing materials and information that may be of benefit to you as you're facing the questions. One of the things, my brother works in prevention down in Washtenaw County, and one of the things he has admonished us, he says, if you see something, say something. It is amazing how many people get cues about someone who is challenged with their environment that are really sending messages to us and asking for help. So again, if you see something, say something, and we will put in the information in the Q&A, contact information for you for the Genesee Health System. Our partner, Katie Baxter, is on along with other partners today to answer questions for you as a part of our partnership as a panel. So if you have questions and you have some information that you need, please look at the resource information that's provided in the chat, as well as put those questions in the queue for today. Thank you. Now, as we move forward today, we have an exciting panel for you. We have, today we're going to be addressing, the faith panel will be addressing COVID and crises. We know we've got COVID, but we've had other crises. We're going to be talking about today the Omicron variant. We'll have an update from the Genesee Health Department, Genesee County Health Department, the City of Flint, and we're going to give some partner highlights again today. So please let me now welcome our faith leaders who have joined us today to be a part of this amazing panel. I'm so excited that without question, all of these pastors said, absolutely yes, I'll be on it. And along with First Lady Sandra Jones, not a pastor with title, but a pastor in the work that she does. So we have First Lady Sandra Jones with us, pastor of Greater Holy Temple, Pastor Daniel Moore, Shiloh Missionary Baptist Church, Senior Pastor James Coughlin from Bethel United Methodist Church, Pastor Reverend Monica Villarreal from Salem Lutheran Church, and Pastor George Wilkerson from Word of Life Church. I'm going to ask the panel if they would open up there you go. I see they're opening up their cameras, and we see all of you this morning. Thank you so much for joining us today. God bless you. Welcome. I'm going to start with just a really simple question. I have given your names and I have given your churches, but I'm going to ask you again. Give us your name, your church, and tell us where you're located in the city of Flint. I'm going to start with you, Pastor Wilkerson.
Yes. George Wilkerson, pastor of Word of Life Christian Church on 460 West Atherton Road in Flint, Michigan.
Thank you. Pastor Coughlin.
Good morning, everybody. My name is James Coughlin. I have the honor of being the pastor at Bethel United Methodist Church, located at 1309 South Ballinger Highway.
Pastor Monica.
Good morning.
Good morning. We got a little feedback, Pastor Monica. No, you got to work on that. Why are you working on that? First Lady Jones.
Mother Sandra Jones of Greater Holy Temple Church of God in Christ, 6702 North Dort Highway, the northeast side of Flint.
Northeast side. Pastor Moore.
Good morning, everyone. Dr. Daniel Moore, Shiloh Missionary Baptist Church is located at 2120 North Saginaw Street in Flint.
And we're going to come back. Pastor Monica, can you try one more time? Okay, while she's working on it, let me ask our first question. We're gonna jump right in here. Each one of you have talked about where your church is located. I'd like you, if you would, just let's have a conversation about why and how you've gotten involved in addressing public health issues through your church. What does this mean to you, Pastor? Let's start with you, Pastor Wilkerson, again.
Well, thank you so much at this distinguished panel. I don't know if I belong, but I'm so blessed to be with you today. The reason why it's important to address the health issues associated with this is just, it's about people are in need and people are being impacted. And, you know, our call as being a Christian and a faith leader is to esteem the things of others more than we do the things of ourselves, to do unto others as we wish they would do, as they would do unto us. And so we want to make sure that we're focusing on the needs of others where there are gaps. And as those gaps occur, we want to have the mechanisms in place to assist and to enrich their lives so that they can go forward in a positive manner.
Thank you. First Lady Jones. All right, you're on mute first. There you go.
Okay, there I go. Well, we got involved with the water crisis in 2016, and the water crisis opened us up to actually see what the needs were in the community. Prior to that, I think it was just like everybody else. We knew that there were some needs, but we didn't know how great the need really was. So that catapulted us to a whole nother level. And then of course, now with COVID, it just compounded the whole issue. So that's why we got involved, and that's why we continue to be involved, because the stress in the community, the situation that the community is going through, it's almost like never ending. So the need is there, the need is great. And therefore it was important for us to not only be a part, but stay a part of what's going on.
Thank you. Pastor Moore.
Thank you, and good morning again, everyone. I think for me, I don't see church separate from community. I think church has to address the needs of community. When I think of the ministry of Christ, very, very social in context, preach the gospel to the poor, heal the brokenhearted, deliverance to the captives, all that to me is all outreach and social. When you study his works, it was all out in the community. So when I became pastor of Shiloh, we started doing things like food giveaways and all of that kind of stuff, which then when the water crisis hit, we were just like everybody else. We didn't know what all the needs were. We were just trying to find a gap and fill it. So we partnered with Salem, Lutheran, and several other places and began to give out water, and then things just kind of dominoed from there with the COVID and everything else. So, but the work of community outreach, community work, I believe in our context, that's what we teach, that's what we preach, that's what we try to do, that church has to be engaged in community.
Thank you. Pastor Coughlin.
For me, I've been at my church the least, I think, out of anybody on the panel. And one thing that I take to Pastor Moore's point, there's a scripture in Matthew that talks about, when I was hungry, you fed me. When I was thirsty, you gave me something to drink. When I was naked, you clothed me. When I was in prison, you came to see about me. And the point of the illustration is that whatever you do to the least of those in society, you also then do to Christ. And to Pastor Moore's point, to Mother Jones, and to Pastor Wilkerson, it is our Christian responsibility to be out in the community, to do work, to be able to right systemic injustices, to right the wrongs that may have happened all throughout. For me, I walked into a situation where Bethel had already been doing the food and water giveaway for years, along with Mother Jones and Greater Holy Temple, and also Pastor Tommy at Asbury. But I know the one thing that was dropped in my lap as soon as I got there, maybe a week, was, would you be willing to turn the church over to be a COVID site? And I enthusiastically said yes, because I think that because it is our moral responsibility to do stuff in the community, we have to be able to show as an example, as the standard bearers for Christ, of what it means to truly be the hands and feet of Christ in the world. And I see no better way for us to do that than to make sure that every day of the week, and not just on Sunday, we are living out the Great Commission and living out truly what it means to be Christ in the world.
So yes, thank you. So each of you have touched on what the connection is to your faith and the work that you do. And so often we hear, where's the faith community? What is the faith community doing? And how is the faith community make a difference? So I'd like you to take a little bit of time now and tell us, what differences have you seen as a result of your opening up your facility, and how you've gotten your congregations involved to make a difference in community? And let's start with you, Pastor Moore.
Had an experience. We started doing, we haven't been able to do it because of COVID, but we started feeding the community on the week before Thanksgiving. We started doing a community Thanksgiving dinner. And I'll never forget, a young man came up to me one year and he said, Pastor Moore, I just want to thank you for doing this for us. And he's standing by himself. I'm thinking us. He was speaking for the community. He was speaking for all of the people around the church who, at least that one day a year, felt the love of God in an outreach way, just simple food and that sort of thing. And when you think of impact, I think he felt like, here's a church in our community that's more than just a building. Here's a church that actually cares about those of us who are out here. We knew when we started doing that little simple program, half those people may only come to our church once a year to eat. But I think as far as an impact, they know that there is a church right here who really cares about what they are dealing with. So if I could say if there's been some impact, I would think that's it. And I think that's something that has been, the people needed to see. I'm certainly not being critical of anything, but that people needed to see that the church cares.
Pastor Wilkerson.
Yes. Well, besides Dr. Moore having that wrong jersey on, he hit everything else right. And so I just believe that, there's a myriad of different things that have been done by all those that are online. And when you see people who are in need, you don't know what they're going through. You don't know the issues, you don't know the barriers that they have in their life. But when they have a significant need met, a basic need, because that's what Jesus did. He met their basic needs first to show his love, and then went into deeper depth to bring them into the body of believers as disciples, or and into the church as we go into the word. And so you got to meet those basic needs first. And when we see that, I've seen people cry and just, because they needed something that wasn't provided. And there were, just as at every site that we talk about that's on this panel, and many other churches, that need was met. And I've seen individuals that did, change their lives relative to giving their lives to the Lord. But it's just hitting those basic needs, providing them with what they need. And that makes the difference initially. That is the catalyst. That is what propels them to more. And in propelling them to more, it positions them for, what we call life and life more abundantly. And so that, it is a difference maker, whether it was giving water, whether it's, Thanksgiving dinner, or whether it was clothing, whatever it is, it's meeting those needs. And people, the majority of people are impacted in a positive way by that. And that brings joy to their life. And that's what we should be about.
God bless you. Thank you. First Lady Jones.
I agree with everything that has been said. For us, I would have to say Greater Holy Temple, when the water crisis hit, jumped in 100%. We were working 14, 15-hour days. And because the pastor, Bishop Jones, is a bishop and is known nationwide, we were receiving water from everywhere. Then, of course, it became apparent to the community that once you had been exposed to lead, after 28 days, the only way to abate that or to even have you to feel good was through mitigating foods. So that's really how the whole process began, with us distributing food in addition, to the water. We found quickly that it was not just water that people needed, but they also needed the food. Yes, the design was to mitigate those who had been exposed to the lead poisoning, but we also saw so many within the Genesee County itself who was coming and said, I know I can't get water, but I do want some food. So that was like a red flag to us. And we opened our doors in January of 2016 in distributing water and food. And we have not closed our doors, not one day, even during this pandemic. The northeast side of Flint is probably, based on the statistics, it's the lowest impoverished area in the city because there's nothing else there. But I don't want it to sound like the Northeast is the only area, because it isn't. We have our lines for water and food every single Thursday is anywhere from 300 to 400 cars. And not just at my site, that's also at Bethel. And that's also at Asbury. So that tells you the great need that's there. And so many of the people that are in the line, they're not there just for the water. They're really there for the food. So Greater Holy Temple, I would have to say, in my opinion, Bishop Jones has really the only area of the church that we don't occupy is the sanctuary. He has just allowed us. We have the COVID vaccines there. We have the clothes closet, because I'm going to tell you, once you start opening your doors, you find the needs for so many other areas like clothing, so that's kind of where we are. And thank you for that question.
Yeah, I want to hear from Pastor Coughlin about how he feels that there's some significant difference. And then Pastor Monica, we're going to come to you. You got a couple of minutes because you got to fill in a lot of gaps from what's happening over at Salem. And Pastor Coughlin.
Yes, and I echo sentiments of Pastormoore and Wilkerson and First Lady Jones as well. I'll say that for me, one of the big things when I came in was just making sure that I reminded the church that we are indeed a church, and we go beyond the standard that will go with us just being a regular community center. As a church, that we are tasked with being able to reflect the character and the witness of Christ in all that we say and that we do. And so my biggest stress to the church is that not only do we provide services, but that we be of service to people. And in that, making sure that we display Christ in all that we say and that we do. We took in, I believe, 12 new members last year before we opened our doors back up. And a lot of them came from people that we met during the food and water giveaway, or that we met during the COVID testing, or now COVID vaccines. And so for me, a biggest part is that, we can be able to utilize our faith in all that we say and that we do. and making sure that we understand that the same love and inclusiveness and grace that Christ showed to us, that we are to do with others, whether it's food and water giveaways, vaccines, or even when we were doing the clothing giveaways in the summertime. And so as we've been able to do that, I think the biggest thing that I'm happiest to see from a faith perspective is a spiritual shift that has taken place in the church as a whole, and it continues to move. And I think that the more that churches like, Bethel and Shiloh and Greater Holy Temple, Pastor Wilkerson, Word of Life, and all the other churches that we have, the more that we continue to do that, the more that we are able to be the standard bearers that breaks any curses that may try to be on our churches now in Flint, that allow us to do even more work individually and collectively in the community.
Thank you, Pastor. Pastor Monica, if you can just tell us real briefly, tell us, we know you're Pastor Monica, we know you're at Salem, but tell us exactly where you're located and give us a sense of why you become involved as a faith leader in this whole public health work, and at least one example of a significant impact you feel it's made.
Thanks, Yvonne. It's great to be here on this panel with distinguished colleagues. I apologize for all the tech issues. We all know how that feels in this Zoom life and world in which we live. So as Yvonne said, I do serve as the pastor at Salem Lutheran Church. We're located at 2610 ML King, which is on the north end, I call it near north end of the city of Flint. And I wear a lot of hats in the community. Certainly as a pastor, we have partnered tremendously over the years, especially in the water crisis, with all of our help centers, as well as with Shiloh Missionary Baptist Church and Dr. Moore. We continue to do that work. We learned a lot in the water crisis and the importance of the faith community to be engaged. All of our churches, our faith centers, are places where not only people look for spiritual guidance and leadership, but the community at large looks for a sense of hope. And a lot of times that sense of hope comes from exactly what Pastor Coughlin said, which is both giving in times of service, but also being in service and reflecting that light of Christ. And that light of Christ is so important in the dark times of crises. And this county has now experienced two major public health crises in the last decade. The city of Flint in particular is now multi-hit in terms of the cumulative effects of the pandemic, on top of the water crisis, on top of other economic and social pressures that our cities experienced. And the faith community has really played an important role, I think, in helping communities stay together, giving a sense of hope. And for me, it comes out of the biblical principles. I think of, the story of the Good Samaritan, which really begs the question of who is your neighbor? And who was the neighbor, right? The one who showed compassion and love to the person who was in need. And all of our congregations and so many others throughout our county have showed that. And I think that's a big part of why I have been involved as a pastoral leader. In addition to my pastoral role, I serve as a community organizer with Michigan United, and we've played a very important part in this pandemic, supporting our health department, supporting the health needs of our county by the launch of a public health navigator program, which has served to help our vaccine clinics with administrative support. It's also, our navigators are out in the community, educating the community on COVID, everything COVID. We keep up on all the latest details so that our community is actively informed and engaged in making decisions for their health and the health of their loved ones. And so that's been an important contribution. In addition to the navigators doing education, we also have a nurse team unit that has supported the vaccine clinics, supported our health department in the sharing of staff, as well as ensuring that we have nurses in our community that are ready, able, and willing to administer the vaccines. All of that for me as a pastor comes out of the active role of faith in community, and that's the transformative love of Jesus at work.
Thank you, Pastor Monica. And one of the things that you've all pointed out is that it's more than just your house of worship or your facility being a place where things can be put without some real connection to your faith and the method within which you see important to reach people. Many times we've heard the church has lost its significance. We only have a couple of more minutes. So I'm gonna ask you my last question now, and then my last question is, will you come back again? Because we won't have enough time to address the next part of this next segment. But just in the next few moments that we have, if each one of you could take a moment thinking about this, what you said, but the fact that people are saying the church has lost its significance. Talk to us about what you're providing at your house of worship, your facility, and what are some next steps that you see for the work of connecting faith and public health. So I'm looking at your microphone. So the first one that opens their mic, I'm going to call on you. But I really want us to answer. So what's your response to the faith? The church has lost its significance, and how do you respond to that? And what do you see next based upon the services that you provide? All right, I'm going to call on you, Pastor Coughlin.
You know, I think that, you know, Bill and Gloria Gaither said it best, that the church triumphant is alive and well. I think that when the statement the church has lost its significance comes up, I think that what that really gets to the heart of is that the church has done historically a horrible job of taking accountability of the wrongs that it may have done to people and to groups that have come throughout history. And I think that we are in a day and an age where, you know, there is a new reformation happening, where there is a new spirit of accountability that's coming. And I think that the more that us as churches individually and collectively as the Church Universal come together and take ownership to be able to continue to shift the church in the direction that Christ wants it to, we will be able to be a church that will be relevant to people of all ages and all backgrounds, that will be able to come and to experience the light of Christ. I think part of that is, you know, continuing to do what we do in offering the service. I know at Bethel, it's the food and water giveaways on Mondays, the testing and vaccine sites Tuesdays, Wednesdays, and Thursdays. I think also with us as a church, as a house of worship, that continues with us being able to evolve and really keeping the spirit first and foremost. You know, I tell the church all the time that it's not my church, nor is it your church. This is God's church. And we will have to move in the direction in which God seeks. So we've had to make a lot of changes around there to worship, to how we do preaching, to how we do music, to how we tackle ministry, whether it's with youth, young adults, with older adults, whether it's starting fun things like book clubs and basketball clubs and other things. Our thing as a church is that no matter what segment of life you come from, there is something that we have to be able to offer to you. And in that offering, we will also have the love of Christ to be able to share with you as well.
Thank you. Pastor Wilkerson.
Yes, I want to try to be short, sweet, unique, and complete, and just say that the church can never lose its significance as long as Jesus Christ is the center of the church. He is the center of the church. He's everything that we're supposed to be about, and our focus has to be aligned with him. Church can never lose its significance as long as we move from definition to demonstration. He defined it, and so we're supposed to demonstrate it. And that's what we do as we move forward in terms of connection and community on a daily basis with the things that we're doing and talking about on this broadcast, connecting with community to demonstrate the love of Christ, which he defined in the Word of God. He is the way, the truth, and the life.
Thank you. Pastor Moore.
Yeah, I'm gonna be even shorter. I could kind of piggyback off my brother, Pastor Wilkerson. But before I piggyback, I just want to say 37 to 33. That's all I'm gonna say. He knows what that is. But I have to agree with him. I don't think the church really has lost its significance. But I think when people say that, I go back to my childhood. I'm a little older. I'm 60 years old. Where the church was the meeting house. The church was the center of community. The church was where people came for different things. And I think when people saw the church seeming to get away from that, that's where they felt like church began to lose its significance. And, you know, people are looking for the church, but they're looking for the church outside of the four walls of that building. They're looking for the church in the public square. They're looking for the church in schools. They're looking for church in the courthouse. People, and especially my dissertation was on millennials in the church, and especially the millennials. They're looking, what is the church actually doing Are you just there in the community? Are you driving in, having service and leaving out? Or are you actually doing something that affects the environment around you? And I think as you asked for next steps, as we continue, like my brother said, in doing the work that we're doing, being a light in the community, helping in whatever ways that we can, I think then the people will view that as the significance of the church being resurrected, so to speak. We're still preaching the gospel. We haven't lost our significance in that respect, but in so many other ways, I think that's what people think. And but we just have to continue. When we give out food, we're being a light. We host a vaccine clinic, we're being a light in the community. Whatever we're doing to help people. And I think as we just continue that, that's really our next steps. You know, all of the pastors, I was meeting with the pastors recently, and we all talked about the fact that we don't know what our churches are really going to look like when the pandemic is over. But we do know that we are in the midst of a people that are going to need even more help than what we are giving now. So we just have to, as next steps go forward, find out what those needs are and fill them, and continue to be a light in that respect.
And I should know I can't ask a pastor to give me 1 minute and that's going to work. I know that's the third close. Thank you, Pastor. First Lady Jones and Pastor Monica, I do have to ask you if you could give us that quick snippet though. First Lady Jones.
The Bible says, with love and kindness have I drawn thee. And that's what has to be the first and foremost in the minds of the church. I see our church as a refuge, not just a building where people come to worship, not just a building where people come to pick up services and commodity. We are, first and foremost, we have to be a refuge, and people have to see us as that. I'm 74, so I'm older than anybody probably on this call. And like you, Pastor Moore, you're right. The church used to be the center of the community. And so it's up to us to ensure that they see that in us again. And we must be loving, we must be kind, and we must be a place of refuge.
Sister Jones, I want those jeans.
Thank you, Pastor Monica.
All of my colleagues.
Wrap it up for us?
That's right. All of my colleagues have shared the points right on. I think what I'll add is, in particularly riffing off of Dr. Moore, as a millennial in the church and a leader in the church and in the community, the church has not lost its significance. I think that the crises we've endured has showed more than ever the strength of the community of faith and the hope of Christ that we have. But when I hear people say things like the church has lost its significance, I do think of what MLK said about the sometimes ineffectual voice of the religious community. And young people, millennials, we're absolutely looking for, how do we work social justice? And how do we engage in the things that create systemic change? And that includes of our very church institutions. And that's the Reformation that I hear Pastor Coughlin speak of. And so my hope and challenge to all of us in the faith community is to not only do what we've been doing, which is all the service and all the engagement, but tie that to how do we make systemic change real and happen so that the daily lives of people, so that our lines get shorter, right, at the food drives, and we don't have people who don't have clean water, and we don't have issues of poverty and housing. That's the real change I think that the young community is looking for and eagerly awaits for the opportunity to engage in as people of faith. And it will shape not only our present, but our future.
Thank you so much. Thank you, Pastor Monica. Thank you, First Lady Jones, Pastor Coughlin, Pastor Wilkerson, and Pastor Moore. We understand that church, that's okay. But we thank God for each one of you. We also want to say to those of you that are listening, this is the face of our faith community. These are not all the faces, but we wanted to help you to understand. These are the places we talk about every week when we hear our next panelist in a moment, Sherelle from the health department, talk about what's going on at these various sites. So we want to thank you, and we're looking forward to you being back with us in another time, in another space, more faith leaders to talk about the importance and the significance of the faith community in addressing public health crises in these times. So thank you. I need to talk quickly to our health panel, because we connect faith and health, our health panel, Dr. Hackert, Dr. Reynolds, and Dr. Deborah Verhoeven. We've got a couple of questions that we really need to get quick answers to. We've heard about this Omicron variant. New, people are asking, what is it? Is it here in Genesee County? So I'm gonna put two questions together for you in this next few moments. And when people are identified as having tested positive with COVID, we don't know what variant it is, but tested positive with COVID, what's the issue and what's the process for testing and boosters? And so I saw you come on first, Dr. Reynolds. I know Dr. Hackert is joining us by phone. So if I could ask Dr. Hackert, what about this Omicron variant?
Good afternoon. I just wanted to say, thank you. Apologize for not, I clearly don't have those genes. It's been a rough week. Regarding the Omicron variant, it is spreading quite dramatically. If you look in South Africa, where it was first identified on the 24th, I believe, about within that last week, between the 15th and the 25th of November, they had 400 cases per day in South Africa, and it went up to 2,000 cases a day in 10 days. And this is the beginning of their summer. So they actually expected cases to be going down, but yet it's going up dramatically. It's also been shown to be dramatically more likely to infect those who are already vaccinated or previously had COVID. However, that's a big however, it still is going to be protective against severe illness to have the vaccines. And so those who are on the borderline of, well, should I get vaccinated? And particularly, should I get vaccinated when there's these new variants coming? The answer is just a very, very loud yes. You do want to get it. You want to get it as quickly as possible. We know that they're going to be partially effective, just like if you think about how there was some protection from the earlier flus that had gone around when H1N1, the so-called swine flu, had come out. The older people who had had exposure to the Hong Kong flu earlier had protection against that. So there is protection that will prevent the more severe cases. But we are seeing it. It is now in the United States. It was first identified, I'm trying to think what day is it, on Wednesday. But now we have it in 5 different states as of about an hour ago. And 2 of those cases, one in Minnesota and one in Hawaii, the people had no travel. There was no associated travel outside of the country. So it is here. It is community transmission. We are able to test at the state for this variant when they have the sample submitted. So they're very hard at work looking for this. How is it going to impact us? We need to continue to do exactly the same things we have been saying, is in addition to get vaccinated, to wear the masks, social distance, wash your hands, ventilate. We have a lovely day relative for, December now. So we want to make sure you crack your windows open, even an inch or 2 will help. So all of those things are very important to do. But the kind of good news at this point, but it's still very few cases in the world, is that it may be a milder form of this, but it's probably about 3 times as transmissible as even the Delta variant, which was more transmissible than the original one. So always wear your mask fitted well over your nose. That's one of the easiest places people can get infected, is the mask slips down over the nose. That's where it goes in.
Thank you, Dr. Hackert. Yes, Dr. Deborah, and then we're going to close this segment with Dr. Reynolds. Dr. Deborah.
Yeah, no, I just echo what Dr. Hackert said. The one caution I would give people is I've been hearing in the media this notion that Omicron and people who are infected with it have milder symptoms. What's being left out of that is that the first 5 cases that have been identified were all vaccinated people. So you would expect the vaccinated person to have milder symptoms than somebody who was unvaccinated. So I just encourage people, stay tuned. We'll keep doing the research. We'll keep digging and unpacking everything that we've been saying this whole pandemic. Get vaccinated, wash your hands, wear your mask, avoid, large crowds and indoor gatherings, watch your distance. all that stuff still applies. All of that stuff still applies. And if people keep that stuff up, they have nothing to worry about, but we will continue to bring good information forward. I was really concerned when I heard the media say that, giving people this false impression that somehow this one, might be one where you get mild symptoms. And I just don't believe that that's the case. So just stay tuned is my point.
So
And
if I
we've got
could just
questions.
add one piece to that, could I add one piece to her comment?
Sure.
The one that we know did not have even partially vaccination is a woman in Hawaii, and she does have what's called moderate symptoms, which still to most people, including me, it makes you kind of think, oh, moderate, that's not so bad. But moderate can be bad. Moderate is where you can't breathe. You go to the emergency room and they say, well, let's just, keep you here for observation for a little while, but you don't get admitted because the hospital's overflowing. So moderate is actually quite severe disease. And again, it's very early, and we know with previous COVID that most people who are going to get very, very sick don't get very, very sick until about the second or third week. So I agree with Dr. Verholden.
Great, and we've got questions already coming in the queue about this, and I think part of it was answer, what does mild symptoms mean? And then the other one was, what does a variant, is it only affecting those who are not vaccinated? And what about younger people? So Dr. Reynolds, you share whatever you want to share. Please put the responses in the Q&A. We're going to try to get to them today if you keep watching and listening. Dr. Reynolds.
All right, I start off with two themes. When you're in the desert surrounded by poisonous snakes, you kill the one that's closest to you. And right now, the closest one to us is the Delta variant for vaccine. So get vaccinated. And all the things that my colleagues have said previously still applies. So please. The other one is Dr. Verholden's favorite theme, make a plan. The holidays are coming. The hospitals are overcrowded. Your doctor's office or clinic office may close during the holidays. Are you keeping up with your visits? Are you monitoring your blood sugars, your blood pressures? Are your immunizations up to date? Make sure you do those things. Know what hospital or emergency room or urgent care facility your provider recommends. Okay, because sometimes you have to be careful. You go to the wrong place, you'll get a bill that'll knock you out your seat. So make a plan or call your insurance company and find out who and where they recommend. And if you don't have insurance, contact Genesee Health Plan, Hamilton Community Health Network, or the Genesee Health System, and they have people who will guide you and direct you. So you got that part of the plan, all right? Make sure your medications are current. Make sure you have your refills before the holiday. And why am I telling you all this? Because we don't want to have to go to the emergency room for poor planning and not thinking ahead. And if you don't have any of these issues, look out for your relatives, look out for your neighbors. Make sure if you know someone has a condition and they have a medication or they have a physician where follow-up is required, make sure they make that connection. And that will be the best holiday present you can give your neighbor, your family, or your community.
Thank you, Dr. Reynolds, Dr. Verholden, and Dr. Hacker. We're going to ask those of you that are listening, please join us next week. We're going to have more conversation around this and the questions that you're posing in the Q&A. Sherelle's going to give us an update from the health department and remind us of the opportunities we have for both testing and for vaccines. Sherelle.
Yes. Hello, it's so good to be
Good afternoon.
That's good information. So we all know that COVID is continually spreading throughout our community and country, which is why our community needs to take the time out to protect themselves by getting a vaccination and wearing our mask out in public. I can't tell you how many times I've been to the grocery store and I'm like the only person wearing a mask. So currently there has been over 370,000 doses of vaccine administered throughout Genesee County. We're almost at 50%, but not quite. So come out to the clinics, get your vaccine, protect yourself. There's so many variants spreading all over the place. Next slide, please. And I also want to remind you that it is important to get tested. The newest strains are highly contagious, so we have to make sure we are not spreading the virus unknowingly. So I've listed on the site on the screen where you could go for a free COVID test. And you just heard from some of the pastors of these churches. So they are a part of helping the community beat this virus. At Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church, you can receive a free COVID test, and you can also get a Pfizer vaccine at any of those 3 churches. And then you could also visit Rite Aid or your local Walgreens or Hamilton Community Health Network to get your testing done. And lastly, I would like to tell you about our upcoming clinics. We have a plethora of them. Today's clinic, which was located at Mount Morris High School, has been canceled due to a school cancellation. But we will have a clinic this Sunday for those who can't get out during the week at the Central Church of the Nazarene on Bristol Road. That time is incorrect on the slide. It should be from 3 to 5 p.m. So this Sunday, December 5th, from 3 to 5, will be at Central Church of the Nazarene with all 3 of the vaccines. And then Tuesday, we're at Our Lady of Guadalupe from 12 to 2 p.m. and we'll have Moderna and Pfizer, as well as in the afternoon, we have an evening clinic from 4 to 7 at Gates Elementary School. And then on Wednesday, our second standing clinic, Central Church of the Nazarene, will have a clinic from 10 to 12, and we'll offer all 3 of the vaccines there. And that evening at 3 till 6 p.m. will be at Southwestern Classical Academy. This gives children an opportunity to get their shots after school hours. And then Thursday will be at Shiloh Missionary Baptist Church, which is also a standing clinic. The time for that is 3 to 6 p.m. and we will be offering Moderna, Pfizer, and Johnson & Johnson. And then Friday from 11:30 to 5 p.m. will be at Lake Fenton High School. So we're kind of spread all over Genesee County to give everyone accessibility to the vaccine. And if you aren't able to come out to any of the clinics that we talk about every week, we encourage you to call us to get placed on our home visiting list where we can come give you your vaccine right at home. And that number is 810-344-4800. You can also visit us at www.gchd.us/vaccine scheduler/.
Thank you so much, Sherelle, and we appreciate having those additional sites set up. We also have coming up next Friday on the 10th, partnering with the Genesee Health Plan, a Be Wise Immunize drive-through event that will offer both flu vaccines and flu vaccines and COVID vaccines. This is a part of the National Influenza Vaccination Week that will start on Sunday. So if you're looking for an additional site, you can come on Friday from 3 to 5:30 to the Genesee Health Plan. Let's be wise and get immunized. Now, Dr. Deborah Verholden, there are some questions in the queue and we've got so much going on. You have got some good information that you want to share with us. Please help us to understand from this equity perspective what's happening.
Yeah, great. Thanks, Yvonne. And I'm having a little bit of a connection problem. So I got my partner in all things equity, Mary Catherine Crawford, is going to back me up if I break up. So if I break up, Mary, you just jump right in. All right. So got you. Thank you, Mary. I'm going to ask all my folks. I'm a data person. I'm going to give you the numbers. I'm going to give you the facts. I don't want to scare people. I don't want to, startle people. I just want people to be empowered by knowledge and data and information. And the data are telling us that we had a decrease last week. About 25% in Flint, cases went down from 394 to 309. And overall in the county, confirmed cases went down from 629 to 1458. I'm going to ask people to just hold tight on those numbers because there were some delays, right? Last week was, that week was Thanksgiving. there were fewer people getting tested, and there are some delays in some of those numbers coming back in. If you look at the next slide, we break it out because we don't want to just show people, the next slide, please. We don't want to just show people the cases and then change the data, right? So we created this new category several months ago called lag cases. Those are the cases that actually happened in that week, but when we reported the data for that week, the data hadn't come back yet. And we don't want to go back and change history. So we add those back in. What I'm guessing is going to happen is in the week and two to come, that number, that lag cases is going to be pretty big for this past week. So I just ask people, take it with a grain of salt. It is the what's so as we have it right now, but we do know that there are some delays in some of that data getting in because of the holiday, and there's likely also a little bit of a dip and decrease in testing, again, because of the holiday. So continue to stay the course, do all the great things Dr. Reynolds and Dr. Hacker have been telling us to do. Next slide. Okay. So we have this big problem with unknown data. And the more cases that we have, the more strain we put on our great human resources and the people at the health department, the people at our wonderful testing facilities, which I have now been to, all of them. I just tip my hat to them and say bravo for the great work that they do. Our real push has been to, keep our communities safe and simultaneously address the health disparities, not just in COVID, but that we've seen in health overall. But we said COVID has really given us an opportunity to confront this head on and implement strategies that we know will work. But with so much missing data, it's hard to say, have we actually kept that disparities gap closed, right? Last September, we started to celebrate because we saw the fruits of all of that tremendous labor from our faith subcommittee, from our task force, from our business sector, from our great philanthropic community, from our academic partners in the health department. So what we did is we're trying to do the best that we can with the data that we have to understand, have we kept that gap closed? And the short version here is, if you look at the latest wave of COVID case data, it does not reveal that the relationship or the association between COVID infection and race has reemerged. In fact, the majority of unknown cases cluster towards communities that tend to have lower percentage of African American populations, right? So we know where the tests are being done, and we have some idea about where the person who's being tested is coming from, even if we don't know their race. And it looks like we can say based on that we've kept that racial disparities gap closed. So this is good news, but again, we want more data, and we want to keep doing our best to get that data in so that we can say it with certainty. We've already talked about the Omicron variant, so I'm gonna skip that. So Mary Catherine has the chance to talk about the policy recommendations, and our other partners have a chance to give their updates. So you can skip forward too, and I'll hand it over to Mary.
Thank you, Dr. Deborah.
Okay, awesome. Always happy to be here with you all, and always happy to kick right off into policy. So there are two exciting pieces of legislation that I am very thrilled to be talking with you about today. So first I want to talk about that as it gets colder in Michigan and these months just keep getting worse, we know based on a mountain of data that inadequate heat during these winter months actually significantly increases health risks. And this is especially the case for our most vulnerable individuals and families. And then because they are more susceptible to illnesses, so for example, the flu and pneumonia. And these risks are only exacerbated by the COVID pandemic. So we need to make sure that people have access to resources and that can reduce these risks to their health. And one way to do that is increase funding to the Low Income Home and Energy Assistance Program. And so this is a service, and I did link it up in the brief, so hopefully everyone got that. And if you can share that with friends, family, neighbors, and community. But this is a service that's going to help families with their home energy bills to make sure that everyone has adequate warmth over the winter. And then again, the new legislation is actually going to increase the percentage of funding to this program so that we can help more individuals throughout these cold months. So the second piece that I want to introduce today is actually legislation that creates the Michigan Climate Energy Corps. So I'm sorry, the Michigan Climate Resiliency Corps. So to give you a little bit more background on why this legislation is so important for disparities, it's because climate change actually disproportionately affects low income and minority communities. And what's more is that these communities are actually the least responsible for the carbon emissions that exacerbate climate change. Right. So by creating a resiliency force, we can take on more green projects in our community and across Michigan. And we can do that by building partnerships with local and state stakeholders. And what's really exciting is that these projects are really nearly limitless, right? They cover a broad range of activities that make communities stronger against the impacts of climate change, including the more obvious activities like tree planting and enhanced stormwater management to preventing flooding and associated flood damage. So as always, I'll be monitoring these two bills as they move forward in the legislature, and I look forward to coming back to y'all with good news.
Thank you, Mary Catherine. It's exciting to see you get so excited about policies. Thank you for that update. Thank you for that update so much. Lottie Ferguson, Chief Resiliency Officer from the City of Flint. Give us what you have for us today in a couple of minutes, please.
Good morning. Let me make sure you can see the M so you know where my allegiance stands for this week. But hey, it's all hands on deck here at the City of Flint to help those who were affected by the November 22nd explosion on Hogarth Street. And so I'm glad there are pastors here. I'm hoping that folks who know of people who may have been affected can get information to them to call us 810-410-2020. There's still a few families that we have not been able to locate. We don't know where they are currently staying, and we want to help them. We have resources available to assist them. So if you know anyone who has been affected by the explosion, please have them reach out to the City of Flint, 810-410-2020. We want to make sure that homes are boarded and secured. We want to make sure that people have access to basic needs and the available resources that the community has so generously stepped up to provide for all of those affected.
Thank you so much, Lottie. Again, churches and community members have really rallied, so we appreciate the support that our community has given. We want to just give a shout out to some of our partners who've joined us over these last 90 weeks. Michigan Department of Health and Human Service, Michigan Public Health Institute, of course, Flint Community Schools, and Michigan United. You heard from Pastor Monica earlier in the webinar today. We thank you for the information that you have shared, what you continue to provide resources and services to our community. It is so important that we continue to hear these important information. So we're going to ask you, please keep putting those questions in. There was something that was put in the question and answer that was brought to my attention to bring out the question about boosters. Each of the sites that you heard today, they are doing boosters for those who are 18 years and above. So when you get there and you need a booster, be sure that you ask them for that. Let me ask our social workers and community health workers, please respond to the request so that you can get your continuing education unit and your contact hours. This is so incredibly important. We're working each week to make sure that this is available to you. And as we close today, thank each one of our panelists for the wonderful information and for answering questions behind the scene. Please continue to join us on a weekly basis. Tell your friends about it. Like us on Facebook. Subscribe to the YouTube channel, Healthy Flint. email us for more questions at info@hfrcc.org, or you can give us a call at 810-835-2130. And I want to say, we know holidays are coming up. There's a question about what will happen during the Christmas and the New Year's, especially as it relates to testing. Join us next week. We'll have those details for you. And we want to say to you, it is important that you recognize the value of your voice. We're here 90 weeks because of you, and we thank you. So we'll look forward to seeing you again next week.